My name is Elizabeth Ziemba, and I'm the president of Medical Tourism Training. It's my pleasure to be creating this recording for you as part of the Crikvenica International Health Tourism Conference. My topic today is redesigning your health travel experiences, the impact of consumerism, COVID, and technology. The events of this year have challenged all of us to create new patient experiences. So in order to meet patient expectations for what has transpired this year, we're looking at the confluence of three areas of events and information. First of all, we have the pre-COVID consumer characteristics, we have the impact of COVID itself, as well as the role of technology. So let's look at these three elements in a little bit more detail. Back in January of 2020, which could seem like a very long time ago for each of us, consumer research was showing the major consumer characteristics that would be determining our strategies and tactics going into 2020 to have a successful year. 5 of the key consumer characteristics are what I call the 5 I's, which is first, informed, impact, individualistic, impatient, and intuitive. The first of the 5 I's is informed. As we know, consumers are spending much more time every year, learning more, searching more online, where there's so much more information ever available to us. So as an example, I've taken Google Trends for Croatia, looking at searches for the past 12 months for terms related to COVID. And of course, in October 2019, the disease had not yet fully emerged, but by February of 2020, you can see people in Croatia were educating and informing themselves about this disease even before the first cases were identified in Croatia. And on the right-hand side of the slide, we see the number of cases in Croatia, which had been relatively low until August of this year and now spiking in October. So what that means is your patients, your clients are coming to you very well informed about COVID. And our response should be, first of all, one of respect for the time and energy that they have spent learning about the disease and coming to you with questions for which we should be prepared to answer correctly, promptly, and to look for information that may possibly need to be corrected. So we need to problem solve and educate for patients respectfully based on the knowledge that they bring to our relationships. Second of all, we have the impact of social change, of climate change. And consumers, especially at the beginning of the year, climate change dominated the headlines. It's hard to believe, but we have had a year of record number of hurricanes, floods, droughts, and other climate events that are still of concern to all of us, I believe all of us. So consumers are looking about what our businesses are doing in terms of sustainability on a global level, as well as what we're doing within our community as demonstration of our corporate social responsibility. And while climate change may not be dominating the headlines, it's still very much part of people's concerns. The third I is individualistic, and what that means is that we have to personalize everything. All of our messages, our creation of our services, our service packages, our content, everything that we communicate must be personalized. Accenture did a survey at the end of 2019, and they're reporting that 33% of customers who abandoned a business relationship did so because personalization was lacking. This is something that we can be quite good at. We know our patients and what their needs are, so we should focus our attention on this and get even better. The fourth I is impatience. Impatient. This is a recent survey question that what is your expected response time for social media questions or complaints? Fully 20% of the respondents in the United States and 18% globally said immediately. And fully another 24 to 28% gave us an hour to respond. That can be quite challenging especially for small businesses, but in this time of COVID, I believe that impatience is even a bigger factor than it had been, where people are scared, they want information, accurate information right away. And the fifth I is intuitive, and that means that consumers know and can articulate their goals and motivations, and our job is to determine what those goals and motivations are and to align our business needs and services with them so that they choose us for our services because we have met their needs and expectations. So we began the year of 2020 thinking that if we met the needs of our well-educated clients who are concerned about climate change, did it in a personalized fashion quickly, and in alignment with their goals and motivations, that we would be delivering the right consumer or patient experience for a successful year. And then, of course, we know what happened next was the emergence of COVID-19 and the global pandemic, which, to say it has turned the healthcare world on its head, could be the biggest understatement that I have made all year. So what do we do in response to COVID-19? First of all, we have to understand that the new patient experiences are based on fear, and it's well-founded fear that needs to be managed and addressed based on facts, information, and in a calm, professional manner about every aspect of the patient experience. And I would say it's no longer a single patient experience. It is now at least 3 distinct patient experiences, all of which need to be understood in quite detail, how it is affecting the delivery of our services and our patients. So first of all, we have the traditional patient experience where we meet with our healthcare provider face-to-face, white lab coat, we're in our street clothes, and this is what we're used to and what we can anticipate. However, now we have the virtual patient experience, which can be uncomfortable not only for the patient, but also for the provider. So it's worthwhile to invest in education and training of providers as to how to give a technologically savvy virtual experience that delivers value to the patient, as well as educating patients about what they need to expect during this virtual visit. And the third patient experience is when we meet face-to-face with healthcare providers who are dressed in some amount of PPE, some of which, when they're in full garb, looks like they should be exploring the planet Mars rather than delivering our healthcare experience to our patients. I'm sure all of you are familiar with the concept of patient journey mapping. And I would say that now we have to engage in patient journey mapping with surgical precision and look at every single aspect of that patient journey from initial contact through post-discharge follow-up. And it needs to be looked at in terms of not only the services we offer, but also every link in the chain of that journey, from whether it's taking a taxi to the airport, being in an airport, getting on an airplane, getting in another taxi, going to a hotel, as well as coming to your place of business. The underlying emotion is going to be fear. And we need to be aware that fear is the overwhelming emotion that is the basis of the patient journey, but the other emotions that will impact the patient along each step of that journey. It's become much more complicated. We need to do it for not only one, but all three of the patient journeys that our patients and customers may be taking. So what can we do to reduce fear? Well, first of all, we need to ensure that we have up-to-date systems and protocols in place. As many of you know, I'm a representative for TIMO's International Healthcare Accreditation that has developed a COVID-19 SAFE program. As part of the business's corporate social responsibility, the business decision was made to make those standards available free of charge to anyone, everywhere in the planet. So all that's necessary is to register and to then gain access to those standards. You can download the standards and then measure them against your systems and protocols to ensure that you are up to date. Second of all, you want to ensure that you are doing everything you can to protect your staff and patients. That, of course, will include having enough PPE on hand and readily available to keep everyone protected, as well as to ensuring the proper hygiene protocols are being implemented regularly, and that you have sufficient supplies on hand for an unbroken supply chain. Lead, be a leader, take the leadership role within your communities, within your professional organizations, learn about best practices, do what you can, and don't wait for government or someone else to show you what to do. Don't be afraid to exercise and demonstrate your leadership. Communicate your care journey. Your communication has never been more important as it is today, and to communicate via a variety of channels to meet all of your audiences in the ways they want to receive your messages. Educate. I hope all of you have COVID-related information on your websites through your social media channels, whether it's COVID libraries, videos, other ways to educate and reduce the fear among patients, staff, and colleagues. And finally, realize that each of these elements is building your brand. So you want to demonstrate your best practices and to reduce the fear that's in the general environment, so that patients, providers, colleagues will want to work with you as a trusted colleague. We need to learn quickly. We need to make sure that our protocols, standards are up to date, and that we communicate effectively, often. And this is a sure way to do what we can to combat COVID-related fears and to build the trust and confidence that patients need. In terms of technology, I'm sure a number of you are already utilizing technology to keep your patients and staff safer. The days of crowded waiting rooms are gone, and distancing protocols are in place. Hand sanitizers are in wide use. I like this example here. It's pedal operated. Instead of having to touch the hand sanitizer itself, it's operated automatically through the foot pump, so it's touchless. The same thing with payment options, tap and go credit cards, payment online, other ways to not handle money or touch credit cards. And of course, the use of taking temperatures without the use of an oral thermometer. I'm sure there are other ways that you can deliver contactless care. And I hope you'll share those best practices with your colleagues. In terms of technology, technology was already emerging as a force to be contended with in healthcare, and COVID has certainly accelerated the use and adaptation of technology, of course, through virtual visits and now through integration of personal wearables with different wristbands, Apple Watches, apps, and so on. Technology is really something that we shouldn't be afraid to embrace. We can use it in creative ways to create upstream and downstream revenue opportunities to help our bottom line. It can be used for educational purposes, and it can be used to encourage better health. And I think some of the lessons we're learning from COVID will help us move forward in the future to deliver better services, faster services for all of our clients. So to improve yourselves and your patients, I would like to just say that these are the key takeaway messages that I would like to leave you with for not only the COVID era, but what I see bringing us forward successfully into the future. Is to, first of all, know and integrate consumer trends with your health communications, your programs, your messages, and all of your services. Reinvent your patient journeys and experiences. Leverage and integrate technology. Continue to build your relationships, build your brand, build better outcomes. And with all of this, I know that we will survive and thrive in the time of COVID and into the future. Thank you for your attention, and I look forward to meeting you virtually again on November 12th and 13th for the Crikvenica International Health Tourism Conference, which will be held online. Thank you so much.